Most people don't experience problems with any of the special senses such as smell or taste until they reach about age 50. At that point, there's a gradual loss of olfactory receptors and gustatory or taste receptors, but that's also coupled with the fact that we replace cells much more slowly at a lower rate as we age. Several age-related changes do occur in the eyes, though. The lens begins to lose some of its elasticity, and so it can't change shape as easily. That can result in presbyopia, what we typically think as old people eyes, right? We have to hold the books farther away for our lens to focus on them in order to read. We'll also look at a couple of additional disorders associated with the eyes, such as cataracts and macular degeneration, after we do just a little bit more of an overview. By about age 60, though, about 25% of people start to develop some type of noticeable hearing loss, especially for really high-pitched sounds. This is very, very common and becomes much more common as we age. This is usually due to damaged or lost hair cells in the spiral organ, but also the degeneration of the nerve pathway. It's also very common to develop tinnitus or ringing in the ears, and the vestibular imbalances tend to occur much more frequently as we age as well. And, well, it looks like I got a little ahead of myself and told you a little bit about the hearing loss before we actually got to the slide. Sometimes when you talk as much as I do, you just get going and you can't stop. All right, so we'll look at some of the retinal disorders and look at some of the other disorders on the next slide. There's going to be a good bit of information here, so I want you just to get the big picture of what's going on with each one of these. I certainly don't want you to get bogged down in learning all of the clinical aspects of these different disorders. A lot of these do tend to develop more as we age. Some of them happen, though, for many different reasons. So we'll begin by looking at a very common cause of blindness that causes the lens of the eyes to become less transparent. And that is when we develop structures called cataracts. So the lens becomes very cloudy due to structural changes in the proteins that make up the lens. Cataracts usually develop with aging, but also can be caused due to excess exposure to UV radiation or certain medications, or of course injury. There are also other diseases such as diabetes mellitus, the common form of diabetes, that can lead to cataracts developing. Fortunately, though, sight can in some cases be restored by the removal of that old cloudy lens and implanting a new artificial lens. Glaucoma is the most common cause of blindness in the United States, and it affects a little over 2% of people over the age of 40. Most cases are caused by an abnormally high pressure within the eye due to a buildup of that fluid, the aqueous humor. The fluid then, of course, is going to push against the lens and put pressure on the retina, and that constant pressure can result in anything from very mild visual impairment to irreversible blindness, as those neurons of the retina are destroyed. It can also cause damage to the optic nerve and then lead to blindness. Macular degeneration typically happens in people over the age of 50 years older, and it's a degenerative disorder in which the macula lutea is destroyed. That's usually the area where we have the best or the most acute vision. So people that have advanced macular degeneration are able to retain their peripheral vision so they can see on the side, but they can't see straight ahead. So sometimes, of course, it's difficult for them to be able to see the face of a person in front of them, and they certainly would not be able to drive a car because they would have just peripheral vision in many cases. It is the leading cause of blindness in those over the age of 75. There is no cure for this, but the progression of macular degeneration can sometimes be slowed using laser surgery that destroys some of those blood vessels that are leaking within the eye. Colorblindness is an inherited inability to be able to distinguish between certain colors. This results from the absence or deficiency of one of the three types of cones. Remember, the cones are your color receptors. The most common type of colorblindness is red-green colorblindness, where the red and green or green cones are missing, so you can't really tell the difference. This does tend to happen more often in males than females, so it's what we call, in a lot of cases, a sex-linked disease, and it can also result in night blindness, or the inability to see well at low light condition. Those of you like me that attended a lot of rock concerts when you were growing up, or if you work in an area with a lot of really loud noises and you don't have proper hearing protection, can develop a condition known as deafness. Continued exposure to high-intensity sounds causes a significant, or in some cases total, hearing loss. The louder the sounds, the faster you lose the sense of sound, as some of those hair cells and receptors can be damaged by those very high-intensity, very large sound waves, especially a lot of the high-pitched sounds. So if you're listening to music through earbuds and people around you can hear it, you're listening in the range of high decibel levels that can damage your hearing. Most people don't really notice when they have hearing loss, but trust me, those people around you know. So I'm telling you now, while you're nice and young, wear earplugs and turn those headphones down. Preserve your sense of hearing. There are certain types of deafness where cells are not destroyed, but as I mentioned when we were talking about the external ear canal and the buildup of the earwax, that can simply cause something known as conduction damage, where the sound waves can't pass through the ear canal. Now, there are other types of conduction damage that are a little more serious, but some of these types of conduction damage, not being able to conduct the sound into the ear, can be remedied pretty quickly by removing the obstruction. Other types where the cells are damaged, such as from those high-intensity noises that shear those hair cells, cannot be repaired. But a cochlear implant, remember the cochlea is the organ of hearing, cochlear implants can be used and implanted to help to restore some of the sense of sound. So these are devices that translate sound into electrical signals that can be interpreted by the brain. So that stimulus is detected, the sound wave stimulus is detected by a microphone. That is then going to be processed and turned into an electrical signal that stimulates the cochlear nerve. That's going to artificially generate nerve impulses that then goes over its normal pathway to the brain. So the perceived sounds may be crude as compared to normal hearing, but they do tend to provide a good sense of rhythm and loudness. So a lot of these sounds are able to be detected and interpreted using that cochlear device. And one more term to talk about, and that is conjunctivitis, or what we commonly call pink eye. So this is an inflammation of the conjunctiva of the eye. This is caused when bacteria gets into the conjunctiva and causes that inflammation to occur, the infection and inflammation. This is very, very contagious and more common in young children. I mean, they're always rubbing their faces, right, and putting their hands on other people. So when you have that bacterial type of pink eye, it is very contagious. This can also be caused by irritants, such as getting something in your eye, or dust, or smoke, or pollutants, or something that's in the air. If it is not bacterial in its causative agent, it is not contagious. It's simply an irritation.